section. And today we will be talking about one of the major organs of the abdomen, maybe one of just the major organs in general, and that would be your liver. Now, if you've never really given much thought to your liver, just think of it as kind of your body's giant giant water filter, to really oversimplify it. It serves a lot of functions of importance, but it really serves as a filter for our blood, taking a lot of different toxins and things out of the equation that would otherwise be a real issue. So today, we'll be looking at the liver and a few other organs like the gallbladder, which runs in conjunction with the liver, as well as the spleen and the pancreas, if time allows. So, as always, if this is your first video, please leave it a like. If you like it, share it with anybody else who might like anatomy, especially if the ASMR like anatomy, or like ASMR, but especially ASMR anatomy too. And if you like these videos, if you've watched a few of them and you haven't subscribed yet, some people haven't realized that they haven't subscribed. Please do. It allows me to continue to make videos for you all. That out of the way, we'll go ahead and dive right in. So again, to orient ourselves, we've got our right upper quadrant, the four-quadrant system, the right upper and the left upper. Well, the right upper is going to be sitting mainly in the right upper, but partially into the left upper, really hanging out on that border of the diaphragm. If you remember from the thorax or from the mediastinum section. Here is a look from below. It's a transverse section inferiorly, and then we can see the omentum and the omental bursa. Here's the stomach. So the stomach is going to be behind it for the portion that it's in relationship with the liver in the same plane, and then eventually we can see the stomach below it once the hem of the liver over here comes to an end. The kidney, or the kidneys, maybe the other kidney is going to be a little bit below here, and then that abdominal aorta and the inferior vena cava. Here's the liver in C2. The liver is intraperitoneal except for its bare area, which we'll cover in 1523. It's going to be another page from now. Its mesenteries form the falciform, coronary, and triangular ligaments. So let's see if we can find those real quick. There's the falciform. The coronary is going to be in relationship with the heart, so it should be... Maybe we can't see it from this orientation. Yeah, we can't see it from here. And then can we see the triangular ligament? Here's the round ligament. There's the transverse colon. Here's the layers of the abdominals. Looks like we can't see it from here. That's okay. Here's the falciform again. Here's the left liver, the left lobe of the liver, the right lobe. There's the gallbladder again, the hepatoduodenal ligament, which connects the liver to the duodenum of the small intestine, and the hepatogastric ligament, which connects the liver to the stomach, and those together make up the lesser omentum. There's a greater and lesser omentum, which reminds me we'll need to go back and cover those. So, indirect reminder there. And then the relations of the liver. These impressions are the organs that it comes in contact with. So the suprarenal impression and the renal impression, that's going to be the kidney overall. The colic impression is going to be your intestines, the duodenum, specifically the small intestine, and then the stomach and the gastric impression. There's the left triangular ligament, which we couldn't see from this orientation. The coronary ligament, which looks to be on the side over here. And then the bare area. Yeah, intraperitoneal except for the bare area. And then this is the hepatic surface of the diaphragm. So we can't see the liver here, we can see the hepatic surface. And because of that, we can see a few different features that we wouldn't normally, like the inferior vena cava and the abdominal aorta. Here's the right kidney. And there's the pancreas, so we've got the stomach kind of resected out of the way to be able to see that. which is a pretty large organ. The liver is divided into 4 lobes by its ligaments: the right, left, caudate, and quadrate lobes. The falciform ligament, a double layer of parietal peritoneum that reflects off the interior abdominal wall and extends to the liver, spreading out over its surface as visceral peritoneum, divides the liver into its right and left anatomical lobes. The round ligament is found in the free edge of the falciform ligament and is the obliterated umbilical vein, which once extended from the umbilicus to the liver. So that's going to be here. And I think that's, and I don't know this for certain, but I think that if you've ever poked somebody in the belly button, like as a kid, and it hurts, I think you're impacting the round ligament, which is why it elicits a reaction. Inferior border, there's the gallbladder, and fibrous appendix. There's that bare area again we could see earlier, so that's not considered intraperitoneal. Visceral surface of the left lobe. That makes this. So this is an inferior view. So we've got the liver, and we've taken it and rotated it, and we're looking at it from the bottom. The caudate lobe, and then what's fine, the quadrate lobe. And it's called this because cauda is head. Cauda, I always flip this. Let's see. No, it's the back. It's the tail of the liver. Sorry. And then the quadrate is named that because of its shape. The right lobe visceral surface. You can see the portal vein, the hepatic portal vein, right hepatic artery, and then the ducts of the gallbladder that are running in conjunction with the liver itself. The bile duct and the hepatic duct right there. Let's see. Yeah, I think that's everything. The triangular ligament over here, the hepatic vein from a different view. So we've got the liver a little bit more rotated here. Posterior view. Yeah, this is an inferior view. This is a posterior view. So inferior, and then we're taking it and we're rotating it up to look at it from the back here. Let's see, there's the caudate lobe again, and that means that the quadrate lobe should be right here. Yep. And the caudate process, the ligamentum venosum here, we haven't talked about that much yet. And then the proper hepatic artery, we could see that over here, but I think we've got a better view of it over here. Here's more about that segmentation. The liver is divided into functional divisions, which are further divided into segments. Each segment is serviced by tertiary branches of the hepatic artery, the portal vein, and the common hepatic duct, which together make up the portal triad. And that's because there's 3 different pieces of vasculature coming together or functioning together: hepatic artery, portal vein, and common hepatic duct. So the blue are the branches of the hepatic veins, purple is the branches of the portal veins, red is the branches of the proper hepatic artery, and green is the branches of the hepatic duct to service these different segments of the liver. And then here is more information on those segments. There's a diaphragmatic surface and a visceral surface, inferior and anterior views, respectively. And we'll go through both, or we'll look at this one if we can see it. So here's one, posterior portion, the caudate lobe, and that's of the left part. And then we have the left lateral division, part of the left part. Segment is left posterior lateral. And then there's left anterior lateral. And then there's left medial, right in the middle. And those are all making up the left portion here. So again, that's 2 and 3. We can barely see 4 from this vantage point. And then we're on the right side now. So 5 is going to be anteromedial, which we cannot see here. Or yeah, we can see it here. 6 is going to be right anterior lateral on the side here and here. Right posterior lateral, 7 here and here. And posterior medial sight from the inferior view. So there's your hepatic segments. Now let's talk about that organ that's running with the liver, the gallbladder and the bile ducts. So the gallbladder, the anterior view is obscured by the liver, but it's going to be in your right upper quadrant. And it has all these different ducts that serve the purpose of distribution of bile. That's the purpose of the gallbladder, and that's why it's designed to assist with the digestion of fatty foods. And that's why some people get what's called a cholecystectomy, which is the removal of the gallbladder. And that's if they are having some real trouble when eating fatty foods. That's kind of a tip-off that it's not functioning the way it should, or it has an infection that is requiring its removal. And sometimes they're filled with gallstones, which is just a different thing that we can get into. Let's see, and then here's another view here, and the main takeaways are this bile duct, this left hepatic duct, and the right hepatic duct, and their distribution ability. Here's the biliary sphincter system, and as you remember, the sphincter, we saw it in the stomach most recently, is that muscular ring that permits or occludes the ability of the distribution of the different products, or allowing different things to go from one place to another muscularly. So here's the duodenal wall. So it's indicating the distribution of bile into the small intestine to assist with the digestion of food. So here's the sphincter of the bile duct, of the pancreatic duct, and the hepatopancreatic ampulla. So this comes in, and this would be to react to the sugar that's eaten. This would be to the fat that's eaten. And then they're both collected in here and allowed selectively into the small intestine. Another view of the relationship between the gallbladder here and the small intestine. We got the right hepatic duct, the left hepatic duct, and the common hepatic duct. The neck of the gallbladder, and then the cystic duct. The neck infundibulum here, body and fundus make up the gallbladder as a whole, distributing into the duodenum, specifically the superior part leading into the descending portion. And then here's the horizontal part down here, as a lot of the biliary compounds are distributed into this descending portion. We've got the sphincter system here is highlighting the duodenum, the muscular coat. We've got the longitudinal and the circular layer, and the sphincter here. So this is this from a different angle. And yeah, I think that's everything we want to talk about here. The biliary tract in C2. So we've removed the stomach, the small intestine, the transverse colon, and the large portions of the liver. So it's mainly except for this portion. The gallbladder is intraperitoneal, covered by its visceral peritoneum, where it is not attached to the liver. Otherwise, it's attached on this surface here. As far as blood supply nearby, you've got the proper hepatic artery, and let's see, what vasculature structures do we have? There's that hepatopancreatic duct opening here into the descending portion of the duodenum. Everything else we've already covered in previous videos, so I don't want to be overly redundant. And I want to get to what most people usually like to see, and that's the clinical box. The extraction of the bile duct. And this, I think, is going to unpack what I was just mentioning a moment ago. As bile is stored and concentrated in the gallbladder, certain substances such as cholesterol may crystallize, resulting in the formation of gallstones, migration of gallstones into the bile duct, which, let's highlight that here. The migration of gallstones in the bile duct causes severe pain or colic. Gallstones may also block the pancreatic duct here in the papillary regions, causing acute or even life-threatening pancreatitis. Alright, so a couple of conditions there that can be worthy of note. So excess gallstones in the gallbladder could be a cholecystectomy. The gallstones in the bile duct can also require a cholecystectomy, but the obstruction of the pancreatic duct impacts the ability of the body to receive and utilize insulin, which is required to break down the sugar that's eaten in your meal. So obviously you can see how that would be very problematic very quickly. And also it would lead to the inflammation and infection in the pancreas, i.e. pancreatitis. Here's an ultrasound appearance of 2 gallstones, which you can see here, 1 and 2, very, very finely. And then black arrows mark the echo-free area behind the stones. So you can see that these 2 stones are blocking, obstructing the flow here, behind it, posteriorly. Moving on to another organ, or another set of organs, the pancreas and the spleen. So here we've got our right and left upper quadrants here, and you can see the pancreas kind of hangs up between both, but more hanging over to the left, and then the spleen is just hanging out on the left side. It gives us the specification of just below the 10th rib over here, which I think is helpful. And then here is an L1 cross-section inferiorly. So there's the pancreas, and there is the spleen. Of course, here's the liver and the stomach and the kidney. So just orienting ourselves here. Here's an anterior view of the pancreas with the dissection of the pancreatic duct. So it's really highlighting that pancreatic duct on its way to the duodenum here. And what we can't see, or what they cut away, is that biliary duct would be coming down here from the gallbladder as well. And then we've got actually an accessory pancreatic duct up here too. As far as vasculature, we've got the superior mesenteric arteries and veins. There is a head and tail of the pancreas. And what else do we want to highlight? Also a neck portion as well. And then here's the spleen, a funny little looking guy. Kind of like the liver light, a light version of the liver. Here is it says posterior extremity, superior border, inferior border, diaphragmatic surface, and anterior extremity. Those same features, but visceral surface flipped around, costal or rib surface, and then visceral surface, aka bordering other organs over here. So this is here, this is here on the outside, costal, because it's bordering the ribs. And then we've got a colic surface, meaning that's bordering the intestines. And then we've got the splenic artery and vein as far as dedicated blood supply. Pancreas and spleen in C2. We've got the liver, stomach, small intestine, and large intestine removed, because all of these organs lie posteriorly in comparison to those. Here is that splenic artery and vein again, the tail of the pancreas, the body of the pancreas, the head of the pancreas, and then in relationship again to that duodenum, the descending portion. And then the superior mesenteric arteries and veins for blood supply to the pancreas. Everything else we've covered. Oh, and then I guess just a little one-off, we can see a suprarenal gland of one of the kidneys. It sits on top of the kidneys. And then here's a transverse section. And that's going to have your pancreatic head here. And this is a superior view, so we're looking top down from the L1 vertebra, or L1 vertebra down, cross-section of the stomach. And so you can very helpfully see the relationship between the stomach and the pancreas. And then also the relationship between the pancreas and, let's see, we can see the kidneys here, which is nice. But I'm looking for that duodenum. It may be, I'm not seeing it at the moment. Oh, there. There it is. And so it's going to feed into the descending portion of the duodenum down here. So this is dipping under the stomach that we can see. And then for the liver, we actually can see at this level the portal vein, the bile duct, and the proper hepatic artery, which again is making that portal triad. Let's see what else. What else? I think that's everything that's new for this portion of the video. So a pretty straightforward analysis of several organs for this video. Next time we'll get into the kidneys and the suprarenal glands, but really already in this video we covered 4 different organs, which usually we aren't that efficient like it's nice that we were able to cover the liver, the gallbladder, the pancreas, and the spleen. I think we'll go ahead and draw things to a close here, and we'll pick up where we left off next time. We will go into the kidneys and the suprarenal glands. As always, everyone, thank you for watching. I've been working on the YouTube thumbnails, so hopefully those have been helpful. But if I need to try to make them a little bit more professional, then I appreciate the feedback on that. Thank you to those of you who continue to leave comments and encouraging remarks. I don't take that for granted. Still figuring it out here, one day at a time. There are some people who've been creators for years and years, and I'm closing in on 6 months. So I know that I've got quite a bit to learn. I appreciate everyone who takes the time to watch these videos and doesn't just click right on through.